Good evening, ladies and gentlemen. Welcome to this evening's semi-final debate. My name is Georgia Zhang, and I am the chairman of this debate. The timekeeper is Brooke Mai. This debate will be judged by a panel of 3 adjudicators, who are Mr. Hazel, Miss Lowen, and Miss Herden. The topic for this debate is that doctors should not tell patients who have low-risk condition that they have cancer. The affirmative team seated to my right is from Glenunga International High School. The negative team seated to my left is from Pembroke School. The speaking time for this debate is 5 minutes. A single warning bell will sound 1 minute before the speaking time, and a double bell will sound at speaking time. Please ensure that your mobile phones are switched off or on silent. I declare this debate open and call upon the first affirmative speaker, Kanechi Achisyogu.
Good evening, Madam Chairman, ladies and gentlemen. The topic for our debate is that doctors should not tell patients who have low-risk conditions that they have cancer. We define cancer as a disease caused by an uncontrolled division of abnormal cells in the part of the body, while we define low-risk cancer as cancers that are non-growing or so slow-growing that they would have no harm on an individual if left undetected or untreated. An example of this, something many men have, is low-risk prostate cancer, which actually causes no harm to the individual, which I'll be expanding on later, and low-risk thyroid cancer. We define should not tell the patient as holding back non-vital information from the patient on the basis that it could harm them. We, the affirmative team, believe that this statement is true. We got this definition from Brooke Nicol, a University of Sydney researcher who was cited on the link provided by Debating Essay. Tonight's first speaker, I'll be speaking to you about how informing the patient of the cancer could lead to major health issues and how monitored low-risk cancers can cause no harm to the individual. Our second speaker will be talking about how an overdiagnosis and overtreatment could harm the patient more, how doctors should diagnose, use a word with less stigmas associated with it, and how the individual may become exponentially more reckless because they think they might die. Our third speaker will rebut and sum up our team case. I'm going to discuss 2 points. Firstly, that letting the patient know that they have cancer will be detrimental to their mental health. Cancer has many negative stigmas surrounding it, inducing feelings of fear, vulnerability, despair, depression, and anxiety among diagnosed individuals because they believe that they might die, which our second speaker will expand upon the drastic actions brought about by this. A study conducted by the Journal of Clinical Oncology reported that in Germany, where they had interviews with over 2,100 patients with cancer, 32% of the patients reported clinical anxiety and or depression that their psychologists reported was worsened by the diagnosis of cancer or brought on by it. Another study done by Merner reported that there was a 31% prevalence rate for psychiatric disorders in cancer survivors, mentioning that rates for depression went from 11% to 37%, and that anxiety disorders had rates from 10% to 43%. However, about 10% of the world's population suffer from anxiety, showing that people diagnosed with cancer are more likely to be depressed or anxious. People are more likely to commit suicide if they have mental health issues, and about 1 million people each year commit suicide around the world. But according to verywellhealth.org, the risk of suicide is about twice as high in cancer patients. However, in the first 3 months of receiving the cancer diagnosis, cancer patients are 13 times more likely to commit suicide than people without cancer, showing that diagnosing patients with cancer has a high chance of compromising their mental health, possibly driving them to suicide or loss of your patient's life. Do we really want doctors to be responsible for indirectly killing someone who has no chance of being affected by the low-risk cancer in the first place? Think long and hard about this. Now to my second point. The monitored low-risk cancers cannot harm the individual. The individual can still get checkups without knowing the specific problem they face. Just telling the individual that it is a tumor that cannot harm them is enough. Treatment is often not necessary for the patient, as the main risk treatments for prostate cancer, surgery and radiation can cause side effects such as sexual, urinary, and bowel problems, while men who choose to take the active surveillance approach often have a better quality of life without the stress and worry that comes from having cancer or knowing about it. As I mentioned at the start of my second point, the doctor is still able to monitor the cancer without the patient knowing exactly what it is, while the doctor will make sure that the cancer doesn't start growing by doing PSA tests, where the doctor counts how many of a cancerous pathogen is in the bloodstream, and a digital screening which checks the prostate gland to make sure that the cancer doesn't start growing. With thyroid cancer, papillary carcinoma, the treatment that is least harmful and most effective is removing the thyroid gland. But even this is unnecessary for low-risk thyroid cancers. Simply monitoring and occasional ultrasounds is the most that is needed according to cancer.org. Now you may say that withholding such vital information from the patient is wrong and illegal, but you are wrong. In 2012, the Supreme Court ruled in the favor that doctors can withhold non-vital information, such as low-risk cancer conditions, from the patient on the basis that the information is one that would harm the patient mentally or otherwise. Do you really need any more proof that the statement that we are arguing about is correct? To sum this up, Madam Chairman, ladies and gentlemen, in conclusion, we, the affirmative team, agree with the statement that doctors should not tell patients who have low-risk conditions that they have cancer for the reasons I've stated above. And remember, the first rule of medicine is not to harm the patient. Thank you.
I call upon the first negative speaker, Navar Hideri.
Good evening, Madam Chairman, ladies and gentlemen. The topic for tonight's debate is that doctors should not tell patients who have low-risk conditions that they have cancer. We, the negative team, believe that this statement is false. We disagree with the opposition's definition. We define the topic as that doctors, people who are qualified to treat someone who is ill, and patients as a person receiving or registered to receive medical treatment. Low-risk cancer as being cancers which cells grow and spread more slowly compared to the high-risk cancer cells, which are fast-spreading and aggressive, according to the National Australian Cancer Institute. Examples of cancers with low risk are prostate and thyroid cancer. We define cancer singularly by using the Collins Medical Dictionary as a malignant condition, meaning that the cells divide in an uncontrolled way, allowing the potential of the cancer to spread and infiltrate other tissues in the body, which can lead to fatality. Today, as the first speaker, I will be talking to you about the roles that doctors have in communicating effectively to patients, and how playing down cancer could also have an adverse effect. Our second speaker will be talking about the ethical, legal, and professional obligations doctors must adhere to. He will also discuss the medico-legal implications of inadequate labelling of cancer. Our third speaker will rebut and sum up our case. To begin with, I would like to point out some flaws in the opposition's arguments. The first speaker of the affirmative team has attempted to convince you that a cancer patient a cancer patient finding out that they have cancer will be detrimental to their mental health. However, as I will discuss in my arguments, playing down cancer can also cause mismanagement and lead to fatality. She also said that monitored low-risk cancers will not develop and harm a person. However, as described in my definition, cancer cells are extremely unpredictable. And so if a patient believes that their tumour is not able to harm them, they may lose diligence in checkups and expose them to the growth of cancer without their knowledge. I will be discussing 2 points. My first point is in regard to the role that doctors play in communicating effectively to patients. One of the biggest concerns in the diagnosis of low-risk cancer is that patients' responsive actions are too extreme, and therefore they take on treatment that could be unnecessary. This information was obtained when the American Cancer Society ran a review on decision-making by patients after being diagnosed with prostate cancer, which is regarded as a low-risk cancer. The authors concluded that the variation in treatment were heavily influenced by how the patients received the information regarding their treatment and diagnosis, rather than the patient's underlying preferences. It is important to recognise that a big role in communicating low-risk cancer diagnosis falls onto a doctor's shoulders, and how the doctor chooses to relay such information can be reflected through a patient's actions. The treatment, therefore, that a patient decides to take can be highly influenced by how a doctor phrases their sentence, how emphasis is used, and most importantly, how detailed and accurate the information about the condition and treatment that is passed on is. These details should also include how the risk of cancer spreading is affected by taking treatment or the chances of growth progression if treatment is averted. It is vital to take into consideration the opinions of the doctors themselves. As reported by ABC, it has been found that majority of the doctors have rejected calls to drop the cancer label from low-risk diagnosis in response to the Australian researchers calling for a radical rethink. Even the doctors themselves, the ones who deliver the diagnosis news, think we should keep the label for low-risk cancers. This is why we believe that the current terminology for low-risk cancer should be maintained. Now to my second point, which discusses the adverse effects of playing down cancer diagnosis. If low-risk cancer is relabeled, not communicated effectively in a way which a patient understands the full risk of the diagnosis, they could make uninformed decisions, which adversely affects their health through mismanagement. Professor Kirsten McCaffrey from the University of Sydney, who is the lead author on the BMJ analysis, which is an international medical journal which leads the debate on health-related topics, believes that relabeling or dropping the label altogether poses a risk. Her concerns are related to the risk of patients not being as diligent with follow-ups and treatment or lose touch with services, and this might affect their eligibility for government services and benefits. She also said that past patients might lose their sense of belonging to a cancer survivor community or believe they were falsely classified or underwent unnecessary treatment. If a patient makes an uninformed decision to take no treatment for something they believe is not a major risk for their health, they run the risk of allowing cancer to further develop to a point where it requires major surgery or radiotherapy and chemotherapy for long periods of time. Cancer, if it is correctly labelled and explained to the patient when it is first detected, can be prevented from mutating and growing into a serious problem and interfering significantly in a person's life. So, Madam Chairman, ladies and gentlemen, in conclusion, we the negative team undoubtedly believe that doctors must inform their patients of any presence of cancer in the bodies using the current and widely known and accepted terminology. Thank you.
I call upon the second affirmative speaker, Jennifer Lord.
Good evening, Madam Chairman, ladies and gentlemen. The topic for tonight's debate is that doctors should not tell patients who have low-risk conditions that they have cancer. We, the affirmative team, believe that this statement is true. Our first speaker has already stated that the psychological impact on patients hearing that they have low-risk condition cancers can be far more damaging than the actual cancer itself. She also stated that monitored low-risk cancers often cause little harm to patients. Today I will be sharing 2 points with you. My first point is that unnecessary treatment and overtreatment is frequently highly detrimental to a person's health. Secondly, that doctors can diagnose patients with low-risk conditions, but drop the word cancer. Before I expand on these points, I'm going to address some flaws from the opposition's arguments. So, The first affirmative speaker disagreed with our definition. However, we disagree with the opposition's new definition because we cited our definition using the website provided by Debating SA, which makes it the most suitable definition for this topic. The first speaker also attempted to tell you that cancer tumours can grow even with low-risk conditions. At the end of the day, the professionals will know if you are at risk, and if you are at risk, a doctor will tell you where to go from there. Not only that, but as our definition has stated, if it is a low-risk cancer, it can be growing at such a rate that it will never affect you. According to the Cancer Council, there are two types of cancer, which are environmental and hereditary. The negative team also stated that low-risk cancers in general are unpredictable. This is incorrect because medicine has grown and cancers can be monitored and stopped if they are seemingly life-threatening. The opposition has also stated that no matter how small the cancer, they need to know so they can treat it and get it removed. But in our definition, we defined low-risk conditions as small enough so it will not harm or affect the patient's life anyway. As our first speaker stated, if the cancer is low-risk condition, it doesn't require treatment that is expensive and could potentially harm the patient. And it can also negate the efficiency of treatment if another cancer is discovered. The negative team also stated that patients want to belong to a cancer survivor society, but this is incorrect because it's entirely out of the point. And finally, the negative team stated that education can't stop all mental illnesses. However, this is incorrect because we can still monitor the cancer, but as soon as it gets worse, inform the patient that it needs to be treated. So, ladies and gentlemen, my first point for this evening is any patient told that they have cancer would most likely assume that they need treatment, even though unnecessary treatment can be extremely dangerous. The National Cancer Institute defined overtreatment as the treatment of a cancer that would have gone away on its own or never caused any symptoms. It could also lead to problems and harmful side effects from cancer therapies that aren't needed. As our first speaker already stated, the psychological damage and stress caused by a patient hearing that they have cancer would be likely to impact their ability to make logical decisions. So they and those close to them will clearly experience extreme anxiety as the word cancer is associated with death. Anyone would feel that getting rid of their cancer will save their life. If this means treatment, that's what they're willing to do. Although it has been proven that overtreatment can be extremely dangerous, and according to The Guardian, radiotherapy raises the risk of heart disease later in life, and surgery comes with the regular risks from anesthetics used, the potential for infection, and even more risks regarding healthy mental well-being. Doctors shouldn't tell patients who have low-risk conditions that they have cancer because these patients might not be in the right state of mind to choose the best course of treatment. Unnecessary treatment is also extremely costly. Asbestos.com states that the average amount a patient must pay to be treated using chemotherapy is $3,750 per session. These individuals are wasting large amounts of money that they and their families may not be able to afford. My next point is that doctors can diagnose the patient with a condition but use alternative professional medical terms. This could be language like mutation, tumour, or a growth of abnormal cells. However, all in context depending on the patient. So, we have provided evidence that dangerous overtreatment could be abolished and alternative language would not lead to harm. So in conclusion, Mr. Chairman, ladies and gentlemen, thank you.
I call upon the second negative speaker, Dylan Westwick.
Good evening, ladies, gentlemen, timekeeper and chairman. The topic for our debate is that doctors should not tell patients who have low-risk conditions that they have cancer. We, the negative team, strongly believe that this statement is false. Our first speaker has already spoken to you about how effective communication between doctors and patients alleviates the concerns associated with low-risk cancer diagnoses. She also highlighted the importance of not underplaying symptoms, preventing mismanagement and premature death. Today, as second speaker, I'll be speaking to you about 2 points: how doctors have ethical and professional obligations, as well as the medico-legal implications involved in misinforming patients. Our definition is more reliable as it's sourced from the Collins Medical Dictionary, which is impartial and free from the bias of an article as published in the debating essay topic. The first affirmative is stated that using the word cancer has negative mental impacts on patients. This is false, as mental implications can be easily managed by psychologists, counsellors and doctors themselves. The medical misconduct and malpractice associated with lying to patients cannot be managed so easily. The opposition also stated that using the term cancer will cause overtreatment. This is false, as doctors' effective communication with the patient prevents this from happening. The Hippocratic Oath, on which all doctors swear by, states that doctors should avoid the trap of overtreatment. It is the doctor's role to educate and inform the patient about cancer. Correct explanation by a doctor enables the patient to make the right choice about their care. They also stated that when monitored, low-risk cancers can cause no harm. This is false, as cells divide in an uncontrolled manner and can develop into high-risk cancers. If cancers like those cause no harm, prostate cancer would simply not be the third biggest cancer killer in Australia, according to the Cancer Council. They also stated that patients will be reckless and concerned about cancer. This is false, as doctors correctly educate patients, and this can alleviate these concerns. And this can be done through explaining it carefully. Now to my first point: there are ethical, moral and professional obligations doctors must adhere to. The professional obligations of a doctor are outlined by the Good Medical Practice Guide, jointly published by regulating body AHPRA and the Medical Board of Australia. According to the Department of Health, a doctor has a duty of care detailing their professional obligations, which extends to a doctor avoiding acts or omissions which could cause harm to the patient. By omitting details or not telling the patient they have a cancer that, according to cancer.gov, has a 1 in 20 chance of killing them, is immoral and violates a doctor's duty of care. According to the Medical Board of Australia, doctors must adhere to the rules of informed consent. Informed consent is a person's voluntary decision about medical care that is made with knowledge and understanding of the benefits and risks involved. Patients must be informed about their care to provide consent. Not telling patients about the risks associated with cancer violates the professional guidelines published by AHPRA. Section 10, Part F, and Part E of Section 14 of the AHPRA Code of Conduct and Good Medical Practices Guide states it's up to the doctor to encourage the patient to be well informed and assist the patient in making well-informed decisions. Not telling a patient they have cancer or mislabeling it does not adhere to the strict code outlined by this guide, and therefore negates the need for a change in labelling. Now to my second point, that there are medico-legal implications involved in not informing patients adequately. Doctors have a legal obligation to correctly and accurately discuss conditions and treatments in a manner that's easy to understand, in accordance with AHPRA's Code of Conduct. Not adequately informing patients or hiding information is not viable medico-legally and constitutes medical malpractice and misconduct. According to the Cancer Council, 1 in 7 people get prostate cancer, and at least 3,195 people are killed by it annually. Doctors are legally obliged to inform patients about the risks of a condition. In the case of Rogers and Whittaker, a surgeon was fined several $1,000s for not informing a patient there was a 1 in 14,000 chance of a complication arising. Not informing patients about something 1 in 7 people are diagnosed with is negligent and will cause litigation by patients. If a patient is not adequately informed about their condition and treatment, as in the case of Chappell versus Hart, the patient is rightfully entitled to sue. To not tell patients about cancer, like prostate cancer, that kills 1 in 20 people who have it, is an absurd proposition that exposes doctors medico-legally. Therefore, cancer labelling should not be changed. So, ladies and gentlemen, doctors should certainly tell patients who have a low-risk condition that they have cancer. Doctors must notify patients once a cancer diagnosis is made, regardless of whether there is a high or low risk. Otherwise, they fail in their professional obligations to the patient and face litigation and potential deregulation. Thank you.
I call upon the third affirmative speaker, Vidi Vera.
Good evening, Chairperson, ladies and gentlemen. As you already know, the topic of tonight's debate is that doctors should not tell patients who have low-risk conditions that they have cancer. My name is Vidi Vera and I'm the final speaker from the affirmative team. And we believe that this statement is most definitely true. I would now like to move on to my rebuttals. The negative team stated that prostate cancer, low-risk prostate cancer, can kill the patient. Well, as we've stated, there is a 1 in 900 chance that the patient will die. That is less than 1%. The opposition has also used the either-or fallacy by saying that if they're not informed of their cancer, they will die. The speaker attempted to tell you that cancer tumor can grow, although low-risk tumors can be secondary to large tumors. Well, cancer can grow based on changes in your body, atmosphere, vulnerability to radio waves, and genetics. And there are other causes that are yet to be found. Cancer is caused because of a change in the DNA of a cell. Having high levels of stress can also affect the cancer and enable it to grow. The well-known cancers that we hear of every day spread at horrifying rates. These low-rate cancers are most definitely unlike these cancers, as we have continually stated. According to our definition, some of these low-risk cancers do not grow at all, and if they do grow, they grow at such speed that they will never affect you. And by telling a patient, as my speakers have stated, by telling a patient you will cause them angst, stress, and they may get treatment that will worsen their conditions. The negative team has stated that a person that has cancer can grow, that the person that has the cancer and the cancer can grow to something worse. They said that someone that has cancer can keep it to feel as if they belong to the cancer community. As the second speaker stated, it is completely out of point. This also appeals to the undistributed middle term fallacy. These things are unrelated. The opposition also stated that no matter how small the cancer, they need to know so that they can treat it and get it removed. As both of our speakers have stated, if the cancer is of a low-risk condition, it does not require treatment that is expensive and could potentially harm the patient. This also negates the efficiency of the treatment if the cancer is discovered. The opposing team tried to tell you that it is morally unacceptable to not tell somebody that they have cancer. Based on our definition, it is more unacceptable to harm somebody's well-being for something that will never actually harm them. If it is against someone's morals to put somebody else's life into jeopardy, then they should really rethink their morals. The opposing team stated that not telling a patient that they have low-risk cancer can backfire on the doctor, as they can sue the doctor. There is no such law that states that the doctor can be held against this, for they have made a decision and they've tried to help the patient that they have. They have justified that decision, therefore the patient cannot sue them. Our second speaker also stated that in 2012 the Supreme Court ruled in favor that doctors can withhold non-vital information on the basis that that the information is one that could harm the patient mentally or otherwise. They also stated that overtreatment is preferable to undertreatment. This point is invalid because we define low-risk cancers that are non-growing or so slow-growing that they will never cause harm to the individual. Treatment of any kind is not required at all, and in this case, overtreatment could cause more damage to the patient than the cancer itself. I would now like to sum up my team's case. Today, our team has talked about the reasons why doctors shouldn't be telling their patients that have low-risk conditions about their cancer. Our first speaker has talked about how causing unnecessary angst and stress will have long-term impacts on the patient. This would be much worse than the low-risk condition cancer. This stress can lead to severe mental health issues which will harm the patient much more than the low-risk cancer itself. She also spoke about how monitored low-risk cancers can do no harm to you. If the cancer has no impact on the patients whatsoever, why put them through hell thinking that they have it? Our second speaker has talked about how unnecessary treatment can harm the patient more. This unnecessary treatment can also create a second cancer. In other cases, surgery can cause the cancer to spread. Her second point was that doctors can diagnose a patient but drop the word cancer. This relates to our first speaker's point about angst and stress. As we have said, the first rule of medicine is to not harm the patient. Thank you.
I call upon the third negative speaker, Jasper Dew.
Good evening, Madam Chairman, ladies and gentlemen. The topic for tonight's debate is that doctors should not tell patients who have low-risk conditions that they have cancer. We, the negative team, strongly believe that this statement is false. Firstly, I would like to again just reinstate our definition, the fact that we defined it from the medical dictionary, which is much more applicable to this topic than the site that the debating essay linked when we were given the topic. The first affirmative speaker has tried to tell you that when patients are diagnosed with cancer, there are many negative mental health impacts. This is wrong because, of course, people who are diagnosed with cancer will not be happy about having this disease. It is a serious disease that no one will be happy about having. However, doctors have to tell patients this legally and morally. And thanks to media and the fact that knowledge about cancer has been so widespread around the world, there are so many support groups that can aid in this patient's mental treatment and well-being regarding their low or high-risk cancer conditions alike. When low risk, the communication between the doctor and the patients is extremely vital. When the patients are stressed to you that their cancer is low risk, the effect of this word cancer can motivate these patients to continue fighting and can boost their cooperation with their GP, as they will naturally want to overcome this disease. As the medical practice guide from the Medical Board of Australia says, good communication underpins every other aspect of medical treatment. She has also tried to convince you that monitored low-risk checkups are fine. This without having to tell the patient that they have cancer. This is incorrect because while in an ideal world the patients would follow up with all their treatments, but will they really? Without being told that their disease is cancer and not knowing and understanding the full complexity of their disease, many will not be as inclined to follow up with their treatments and checkups compared to if they had been completely and fully explained that they have cancer. Additionally, if they find out that doctors withheld this information from them, especially information on a serious disease like this, a serious scare factor disease like cancer, the doctor-patient trust will be severely damaged. The second affirmative speaker has talked to you about how unnecessary treatment can be detrimental to the patients. The answer isn't not telling them that they have cancer. If the doctor says to the patient that their cancer is low risk and fully explains the various treatments and ways to monitor it, the patient will not flock to surgery. The idea of surgery is almost as scary as the idea of cancer. So if doctors fully inform their patients on why their cancer does not necessarily need surgery and what they can do to monitor it with them, the patients are exceptionally more likely to cooperate with these recommendations. Throughout their argument, that the affirmative team has tried to say that the doctors they can always tell when cancers are low risk and high risk, and that these cancers cannot grow. This is not true because according to Cancer Council, cancers are always unpredictable and they cannot be 100% detected all the time, as it is the case with prostate cancer, whereas according to Cancer Council, the difference between slow-growing and fast-growing cancers is never 100% apparent. Saying that all cancers can be detected and decided on whether they'll be deadly or not is absurd, as the very definition of cancers, as defined by our team, is unpredictable malignant growth. They have also said that cancer support groups are irrelevant. This is false because we stated as when the patient knows and is told by the doctor that they have a low-risk cancer, many may have some negative mental health impacts. But with these cancer support groups, they can go through and help deal with this mental stress that may come with even a low-risk diagnosis. And they also reference the Supreme Court decision about the doctors not having to tell their patients about cancer. But they did not provide any evidence to support that the Supreme Court specifically stated that cancer itself is a non-vital part of the diagnosis. Our first speaker has already stressed the importance of the doctor's role in relaying the information to patients regarding their medical condition, and now fully informing the patient with the cancer label attached will ensure that the most effective forms of treatment can be taken. She has also talked about how removing the word cancer from the patient's diagnosis can downplay the severity of the patient's condition and reduce their incentive to receive often crucial further treatment and follow-up appointments. Our second speaker has explained that doctors have ethical, professional and moral obligations to correctly and inform their patients about their condition, and how by removing the cancer label from the diagnosis, they are violating the medical code of practice. He was further extended this by discussing a doctor's legal obligations in regards to fully and explicitly disclosing information regarding their patient's medical condition and recommended treatment options. So, Madam Chairman, ladies and gentlemen, in conclusion, we the negative team undeniably believe that neglecting to tell patients that they have cancer is legally and morally irresponsible. Low risk does not equal no risk, and everyone has a right to know what is going on exactly inside their body. Thank you.